Welcome to the Best of Beaver County, presented by St. Barnabas, a weekly segment dedicated to putting the focus on the amazing things and the amazing people behind them in Beaver County. The Best of Beaver County is sponsored by and content is provided by St. Barnabas. The show airs every Thursday from 11 to 11:30 on WBBP, WMBA, 99.3 FM, and Facebook Live. Now, with no further ado, let's welcome host Mike Romai to introduce today's program.
Good morning. This is Mike Romai, and this is the Best of Beaver County on the St. Barnabas radio station. It's good to have you here once again, and we're thrilled to invite back Jeff Boast from St. Barnabas Health System. Jeff is a neurological physician assistant, and he has co-authored, along with Dr. Maroon, a book entitled Fish Oil, the Natural Anti-Inflammatory. Dementia Prevention and Memory Care is the topic of conversation. Jeff, welcome back to the show.
Thanks, Mike. Glad to be here.
So good to be talking with you once again. We get so many people saying how much they enjoy your participation and the information that you're passing along to us.
That's great to hear.
Topics this morning, and we have several of them, but we want to hone in on therapies and technologies used to improve the quality of life in dementia patients. Can you add anything to that? Can you tell us more about it?
Well, it's a great topic, Mike, and we've gone through a lot of different topics. But the importance of technology is becoming more and more important. We're learning that certain stimulation can be done with the brain using certain technology. So I think today is a great day to go over all that.
Yeah. Now, is there a difference, and if you would, tell us about the difference between cognitive and functional capabilities as far as impairments are concerned?
Well, as we talked before, dementia is a progressive problem that can involve all aspects of the brain, including the functionality of, for example, swallowing and speaking, the ability to walk can be affected, but also the brain, the memory, the emotions can also be affected. So as time passes, all those things need to be addressed, whether it's through physical therapy, occupational therapy, speech, swallowing therapy, and again, the hands-on touch, having the care that's needed for someone with dementia.
Jeff, are these motor skills that decline as dementia or Alzheimer's takes hold even more in a patient?
Well, I think it is a progressive problem, and one disability sort of builds on the other. If you can't walk, you're more isolated. If you have trouble swallowing, it affects all your organs. You lose weight and protein. So the ability to slow those deteriorations down is one of the things that are important in dementia care.
Yeah, and maintaining quality of life through these treatments, does it depend on the dementia characteristics?
Well, I think there's always room for quality of life, Mike. I mean, we have people in the end stages of dementia that can't speak, for example, and yet they respond very positively to things like music therapy and therapies involving virtual reality. Hands-on, for example, touching pets and so on can be stimulating. So although the quality of life can deteriorate, you can address whatever the problem is and the best way and improve quality of life.
How much does cognitive impairment present in a dementia patient?
Well, again, that's variable, and I think one of the things that most people think about dementia is it just involves the thinking and the cognitive aspect, forgetting things, the ability to lose your ability to feed yourself, for example, or keep track of your money or your medicines. But it also affects other parts of the bodies, including our sensory system, our balance, our ability to swallow. So all those things can be affected.
Would you spend a little bit of time, Jeff, on talking about the rapid advancement of technologies in cognitive therapies?
Well, I speak to it, but I'll be delayed by the time we speak to it. It's really advancing rapidly. And the good thing is a lot of grant money and research money, both private and public, are going into this field basically because of the extreme swiftness at which Alzheimer's and dementia are taking our population. And especially now, as we mentioned during COVID, it's really an epidemic. But the technologies are advancing. As simple as a radio was a very good technology for someone 10, 20, 50 years ago, but we've advanced, and some of the things are virtual reality. We have smart alarms to know when someone gets up or moves to prevent falls. We have bands that people wear that only allow them to have access to certain doors. These are some of the technologies that are moving on, but there are even simpler things like taking someone outside and enjoying the fresh air and having that space available. Allowing lots of sunlight into a room, for example, is another type of therapy. So both technological and more simple technologies are being used to stimulate patients with dementia.
Can you give us some detail about traditional cognitive stimulation, the use of money, word games, music, and even pet therapy?
Right. All of those are on the table, and whatever works, you use them. The idea of games is certainly something that's been around for a while. It is limited in its use to the cognitive dementia of a person, but certainly stimulation with games, and not a game by yourself. They talk a lot about Sudoku and other games where you play by yourself. Games that are played with other people, for example, card games. Even simple card games can be more stimulating than the ones that are done by yourself. You get the feedback, you get the interaction. So those are definitely worthwhile and can help people with cognitive problems.
Mm-hmm. So then, because you're so much a part of the program at St. Barnabas with memory care, can you tell us why this has been so important and such a major priority at St. Barnabas?
Well, as we know, the biggest risk factor for dementia is age. And as we age, places like St. Barnabas come into play and want to help both physically and now more to help the cognitive decline that can occur as we get older. And so many people are turning to St. Barnabas because of its advancement in cognitive decline and care for people with dementia.
Okay, and we're going to take a short break here in a second, but in the meantime, if you'll please give us the website and a phone number where they may be able to reach out and get information.
Absolutely. Well, St. Barnabas, as we've talked several times, has an initiative to provide a free evaluation, whether it's in-home or by phone, of someone who has memory care problems and may need to be in a memory care facility. And that is available both on a website at stbarnabasmemorycare.com or available at 724-443-0700. And just the simple information that you can learn now may add to your knowledge later on when you really need to know where someone needs to go in order to be cared for.
All right. Jeff, hold tight there for a minute. We're going to take a short break and then be back with you. It's the St. Barnabas radio station. Jeff Boast is our guest, and we are talking about dementia prevention and memory care at St. Barnabas Health Systems. Stay right where you are. We'll be right back.
They cared for you, and now you're caring for them. Caregiving for a parent experiencing memory loss can be challenging. St. Barnabas Memory Care is here to help. We offer a free in-home consultation for you and your loved one. Why not talk to St. Barnabas Memory Care Specialist today to discuss your individual situation? This no-charge evaluation can assist you with caring for those who have cared for you. Call 724-625-4000 or go to stbarnabasmemorycare.com. St. Barnabas is apart from ordinary.
This is the best of Beaver County on the St. Barnabas radio station. I'm your host, Mike Romai, and we're talking with Jeff Boast from St. Barnabas Health Systems, and we're talking about cognitive decline, cognitive impairments, and dementia. It's part of a series we've been running with St. Barnabas Health Systems because of the number of people in the community, in our community, the caretakers in our community who are caring for patients with cognitive decline and dementia. And Jeff, we continue to see those numbers growing, and it's important that you're finding things out at St. Barnabas concerning how people can live with the cognitive decline, the Alzheimer's, the dementia, and lead full lives and take away some of the stressors and pressure that perhaps the caregivers have.
Right. It's all about knowing the timing of burnout. You know, a caretaker can only go so far, and then you get to a crisis. And the idea of St. Barnabas and the information that they're providing is to try to prevent that crisis. We don't want to have the situation get out of control. And information that we're providing now through the phone call and the in-home visit really will help as we move forward.
And what we're learning through our conversations with you is that the quality of life can improve for those with dementia and cognitive decline.
Well, the idea is, you know, at some point the caretaker, you know, the quality of life is best as they can do. However, it becomes overwhelming. And St. Barnabas are professionals. They're all trained. They all have professional degrees. And the point is, when you enter a place like St. Barnabas, you're getting all the advanced care that can be available with you 24/7. Whereas at home, it may not have been available. It might have been a therapist that came in once a week or something like that. Whereas at St. Barnabas, these things are more often. They could be daily, includes group sessions, as well as the technology that we were talking about. The technologies that are available at St. Barnabas, things like virtual reality, nature therapy, music therapy, and all the occupational and physical and speech therapies that are available. It's really a universal care from cognitive and physical perspective.
Yeah, at St. Barnabas, because this is such a major initiative, do you seek out or recruit special people to work with dementia patients, Alzheimer's patients?
Absolutely. You have to have the right certifications and qualifications. All of our employees have excellent reputations, well known in the community. As a matter of fact, a number of them have spoke to national organizations, including the Alzheimer's Association on dementia care. I myself was part of a Alzheimer's Association lecture last year regarding the use of virtual reality and the initiative that's gone on at St. Barnabas. Also, others are seeking out St. Barnabas as, I wouldn't call it a laboratory, but as a place to use new technologies. There's different companies that are coming and asking St. Barnabas to look at it just because of the reputation that's there and the professionals that are there. There's also people that have asked St. Barnabas to participate in things like ballroom dancing, where patients with dementia are able to do ballroom dancing, or boxing therapy for people with Parkinson's disease. So a lot of these things are coming to St. Barnabas, and a lot of these things are being initiated by St. Barnabas.
Wow. So ballroom dancing, virtual reality, advanced use of computers, those are all processes of programs of participation for the people with Alzheimer's and cognitive decline, and it can help them even a little bit?
Well, again, the idea of help, Mike, what we're trying to do is we're trying to improve quality of life.
Yeah.
And it has to be targeted to the right individual. And this is one of the best things that I think St. Barnabas does, is knowing what someone can tolerate. You don't want to overstimulate someone. You don't want to increase agitation. And so some of these things are too much, but others, like virtual reality, which is rather sedate. You sit in a chair and you watch it, whether it's watching puppies play or going on a hang gliding trip, or, for example, one of our residents had honeymooned in Paris, and so the virtual reality was someone walking through the streets of Paris, and she was recognizing the different locations in Paris that she saw at her honeymoon, and she commented on the idea of someone with dementia remembering and commenting is a milestone. Others with dementia have looked at have heard music and began singing where they had been primarily mute for a number of months or even up to a year or so. So these things are stimulating the brain, and it's helping, and it does improve quality of life.
Wow. So you're looking for that spark, that little glimmer in someone's eye, perhaps, or that jogs their memory on something that they may have forgotten for quite a while.
If you can do that, Mike, you definitely smile when you go home and think of what a great day you had, because that's the whole goal, is to improve a quality of life. And you don't always get the feedback when someone has dementia, whether they can't speak or whether they are unable to really understand what's happening. That spark, as you described, is exactly what we're going for.
Can cognitive decline be reversed?
Well, it's a good question, and we get that question a lot. You know, there's lots of reasons for cognitive decline. There's chemical problems, hormone problems. There's someone who might have a stroke, for example, and those are related to cognitive decline, brain injury. But generally, a disease condition like Alzheimer's or other progressive dementias are generally not curable, but the idea is to stabilize it as long as you can. And we know that stimulating the brain can help prolong the active parts of the brain. And this is, we've talked several times now, how isolation and lack of socialization that can occur, including people watching TV, because that's not socialization, has had a very bad accelerator effect on worsening people with dementia, and increasing actually dementia patients' death rate. So we really have to think about, you know, how we are stimulating patients and doing a better job universally. And this is one of the things St. Barnabas has taken to heart.
So you don't want them to be a passive participant, even in the home?
Absolutely not. Passive is not the way to go. You know, sitting out in nature and hearing the birds and feeling the breeze and the sunshine is definitely a very active participant. Sitting in a chair and watching a nature scene is not an active participant. Now, virtual reality is different. It's an immersive technology where you actually feel like you're walking through the woods, and the sounds are coming through headsets on your ears. So, as a matter of fact, at some point, we're using smell sense. So, for example, if you're walking through a pine forest, you can have some the scent of pine within the room that further stimulate the brain. So these are things that are much more active, much more participatory as far as the resident.
Jeff, how is a person chosen to participate?
Well, it's not the chosen part is more or less their ability to participate. All comers, of course, are welcome. However, some will be more suited for it. You know, the music therapy is at a certain level. Virtual reality is a certain level. Walking outside nature, all the other therapies that are available, whether you can participate in using a musical instrument, doing ballroom dancing, all those things are more related to their ability to do it, because no one would be excluded. It's just they're matching up the right person with the right stimulation.
Okay. Now, when you talk about the mind virtual reality, can you tell us about the process of that participation between the patient and the apparatus? How do they get comfortable with it?
Right. So you have to remember, all these technologies have a person with them. So the person of the employee or the professional at St. Barnabas, along with a person with dementia. The technology is an aid that we use, but it's always with a person administering it or managing it or running it. So virtual reality is the exact same way. We have an excellent coordinator and director of the memory care virtual reality program who works with the resident to determine what are their likes. Do they want to see big band music? Do they want to see puppies? Do they want to see nature? Do they want to go on travel? That I mentioned earlier about going to Paris or other places around the world. So it's an interaction. And then the really cool thing about it, Mike, is afterwards to have a conversation with that person with dementia and ask them, what did they see? What did they remember? What did they hear? And those are really one of the most gratifying times that we found through a separate therapy, an individual therapy after the virtual reality, to get the feedback and what really sank in. And some of the residents remember the next day and say, I want to see that again, or I want to watch that. So it's a really exciting, stimulating technology for both the the St. Barnabas folks that are running it, as well as the person who's receiving it.
Boy, that's something I'd like to hear more about, when a person can retain what they saw. And you said maybe even a couple days later. That must be pretty gratifying, especially for the family members of that individual.
Well, that was, I didn't tell you the third arm of the triangle, of course, the family. And we always encourage the family to participate in any of these activities as far as either observing or administrating. And the families have been, as you mentioned, overwhelmed by someone, for example, who hadn't been verbal and all of a sudden singing to a song that they're hearing in a virtual reality method. So all these things are important for everyone involved, but it's a concerted effort, and it's trying to match the person with the right therapy or the right technology.
Are old home movies, videos, and things like that, would they be a good tool to use in this sort of therapy?
Absolutely. Home movies are one of the most stimulating things. Christmas dinner back several years ago, looking at grandchildren. Those things have been around, fortunately, for a while, relative to digital technology, the use of tablets, and so on. And now they're being converted to virtual reality, but the personal stimulation of walking through someone's hometown, for example, looking at the old town square, the drugstore, and then going, after you're done with that, back home to a turkey dinner at Thanksgiving with your family, all virtually, is really an exciting new step that's just being started.
Jeff, every time we talk with you, we also mention that you, along with Dr. Maroon, co-authored the fish oil book, The Natural Anti-Inflammatory. How does fish oil work into dementia, cognitive decline, and how soon would a person need to start adding that to their diet?
Well, 30% of our brain cells are made out of omega-3, which is the active molecule in fish oil. So that's a fact. The other fact is about 90+% of Americans are depleted or short on omega-3s in their diets. So you have a mismatch of the need. The brain cells continue to divide and make new brain cells. So we need that source material to make them, but we're deficient in them. Our number one fish food in America is a fried McDonald's fish sandwich. So you really don't get the amount of omega-3s that you need for your diet. And so supplementing with omega-3 supplements is the way to go. From they give it to mothers before they have a baby, and really there's reasons to take it all your life unless you eat 2 or 3 meals of fresh fish a week. And then you have to worry about any lead or mercury in the fish. So it's really an essential ingredient to life.
Mm-hmm. Does it act as a form of lubricant because the brain, is it a muscle like the other muscles in our body that we need to care for them and exercise them through these different programs that you're talking about at St. Barnabas, but also, you need to keep moving them to make them pliable so that they'll keep growing?
Well, I think you're talking about two things as well. One is the idea of brain stimulation does make the brain more pliable and more receptive and more of a chance to grow and build. Fish oil is the substrate or one of the nutritional products that can help that. So they are hand in hand, but without one and without the other, they have to go together.
Mm-hmm. And Jeff, I know that you folks at St. Barnabas Health Systems, you're very excited about these technologies and developments as far as cognitive repair is concerned and dementia is concerned. Share some of that information with our audience and as to why you're so excited about every day when it seems like something is changing and improving in the minds of Alzheimer's and dementia patients.
Well, I think the excitement is the fact that, technology is only as good as if it works. And there's every day something coming out, and you don't really see the feedback that the people hype about. And in virtual reality, this is something we've actually seen the absolute positive feedback in both the patient family, the caregivers, as well as the patient at St. Barnabas Memory Care. So it's something that the proof is in the pudding. We are seeing that this device is being used around the country And the knowledge that we're learning from other facilities, for example, Stanford in California has now approached St. Barnabas about doing a study and learning more about virtual reality. So it's universally becoming very positive as far as the feedback that we're learning. And so that brings you back, that's exciting, and it brings you back to using it again and again.
So are you exchanging ideas and developments with other facilities around the country? You talk about virtual reality and some of the other things. Are they contacting you and say, hey, we understand that you're working on this and you see some improvement in these patients? And are they sharing the information with you and you sharing it with them so that it could help people not only nationally but globally?
Absolutely. This has been part of lectures that have been given to Alzheimer's Association and webinars. The information back and forth, the exchange of information is critical, and St. Barnabas is part of that. So, we're learning every day more and more. There's subtle techniques that we're learning, and we're also expanding that to other people by the lectures and written materials that are going out. So it's a mutual, everyone wants someone with dementia to do better, whether they're here in or whether you're in California or Pennsylvania or Pittsburgh. Everybody needs to work on this together.
And does it matter, Jeff, the age of the individual? Because although many times when we think of Alzheimer's or dementia patients, we think of somebody maybe in their late 60s or 70s who comes down with the disease. But yet there are some younger patients in their 50s and maybe even some in their 40s. Does it matter when it comes to age and at what stage of this development they contact St. Barnabas?
No, it does not matter. All are welcome. But there are subtle differences, what you just described as far as the age of onset. Typically, the age of onset is in the 7th or 8th decade, so it's significantly older as far as the classic dementia associated with Alzheimer's disease as a neurodegenerative problem. There are genetic causes that we discussed in the past relative to Alzheimer's disease that can strike earlier and related to genetic changes. So those are certainly, they act the same, they have similar symptoms, but the ages are different, and the cognitive decline, the rate of cognitive decline is also different. But the point of you're asking is all people are welcome to St. Barnabas. Whether they're young or old or in between, because this is a place that has the expert care to help them.
All right. So someone listening to this program today and they think, yeah, I should find out more about that. They contact other family members and say, hey, St. Barnabas Health Systems is doing this and it's helping Alzheimer's and dementia patients with cognitive decline. How do they get a hold of you?
Well, there is a 724 number to call relative to a free evaluation, whether it's in home or it's by phone, and that is 724-443-0700, or they can go to stbarnabasmemorycare.com to learn more.
Jeff Boast, this is a life-changing and important topic, and we are so pleased that you're able to join us on these several weeks to discuss it and let our listeners find out more about these groundbreaking technologies being used at St. Barnabas Health Systems. Thank you so much, Jeff.
Thank you, sir.
This advice is helping increase the quality of life for people with dementia and Alzheimer's. And we hope you're enjoying it and understanding and learning from it as well. We will get back together again next week. Jeff Boast, our guest, we thank him so much for being with us in the St. Barnabas radio station. I'm Mike Romai. We'll do it again next Thursday morning on this very station. Thank you. Stay safe.
They cared for you, and now you're caring for them. Caregiving for a parent experiencing memory loss can be challenging. St. Barnabas Memory Care is here to help. We offer a free in-home consultation for you and your loved one. Why not talk to St. Barnabas Memory Care Specialist today to discuss your individual situation? This no-charge evaluation can assist you with caring for those who have cared for you. Call 724-625-4000 or go to stbarnabasmemorycare.com. St. Barnabas is apart from ordinary.
Thank you for listening to the Best of Beaver County. St. Barnabas is pleased to have provided content and sponsorship for the program. Tune in this Sunday at 11:30 for an encore presentation of today's program on Beaver County Radio. And next Thursday at 11 for another edition of the Best of Beaver County on